Welcome back to another PCBH Snippet. This is one of my favorite times of the year. It's budget season, and we're working hard to make sure that we're able to accurately predict how many clinics people are going to work, how much productivity we can expect. And it's another time that myself and our coordinator, Maria Ortiz, get to sit down and chart out the templated schedules for our PCBH providers next year. Now, we take a lot of time and effort to do this, and it's a whole process. And I thought it might be helpful just to share this with you all about what our process is to really make sure that our PCBH providers have a templated schedule that they can expect, that there's a routine to it, and most importantly, it reflects that our services, as far as PCBH at CHCW, are life-saving. And what that ripples out to is that if a service is life-saving, we got to make sure there's adequate coverage of BHCs in the clinic, much like a hospital that needs to make sure the hospital is staffed with a certain amount of providers and physicians. We at CHCW believe, hey, each one of our clinics, they have an expectation about how many BHCs are going to be on in a given day to make sure we get enough handoffs and to serve our community. So this whole process begins with us first reaching out to our team and asking them about preferences for schedules. So this would be, what maybe days do you want admin time and project time and paperwork time? And those are important things that we want to make sure to intentionally schedule in throughout the week, because we know working in PCBH, especially working in a lot of clinics, can be draining. It can be tough. While it's a value congruent behavior, it can be taxing at times. So we want to make sure that they're fulfilled and they're healed in these off times, that they get to work on passion projects, they get time to do documentation, and they get time to work with our trainees, whether it be our family medicine residents and our psychology PCBH interns or fellows. So this then ripples out to them giving us feedback on like, hey, these are the clinics that I want to be able to work at and populations to be able to serve throughout our 5 clinics. These are the type of trainees I really like to work with, and here's some preferences on the days of the week I wish I had my project and my paperwork time. Myself and then Maria get together and we try to come up with templates. And what we did today, and I finalize our Excel spreadsheet. So there's a lot of different names and things on here that you don't have to worry about. And as you can see, we have all of our BHCs listed, all 20, close to 20 BHCs for the next year. And we have also an algorithm here down at below that counts up how many BHCs are in clinic. So for instance, say for this rural intern, say we're going to change them to have paperwork time in the morning on Monday. If you look down at this line 41, this number 6, it's actually going to change to a 5 because we changed that to paperwork instead of them being in clinic. Now, what happens is you can see some of these things turn red, is that we had expectation of how many BHCs we need to have on to make sure that we're really reinforcing that idea that providers can expect how many BHCs are on. The other BHCs feel confident going into the day because they know they have team members to fill all the handoffs, and it reflects that idea that BHC services are life-saving, that we have an adequate number of providers on. So in our algorithm, as it drops below certain points, it turns our numbers red to let us know, hey, we got some work to do. We got to make sure that we get more BHCs. We have to switch around. If we can't switch around, that probably means we need to maybe block some more handoff spots to make sure that we get enough handoffs or we have enough coverage to meet the demand. All this ripples out to this moment right now where for next year we have a templated schedule that our BHCs can expect. Yes, there's variations when people are taking PTO, we might have to switch around people's projects time, but largely they know the week that's coming, they know their schedule, and it ensures coverage throughout all of our clinics to make sure that BHCs are seen as life-saving, BHCs feel supported because they have a team, and medical providers and staff know, hey, we got a bunch of BHCs on, so we're going to give lots of handoffs. I would love to know what other people do to ensure coverage, and also to do something for our BHCs that prompts engagement, and also refueling and making sure that they're healed in their off time. Till next time.